You are about to undergo a fine needle aspiration biopsy of either a thyroid nodule or a lymph node in your neck. The goal of this procedure is to withdraw cells from the nodule or lymph node so that they can be examined under a microscope. This can be done with or without ultrasound imaging guidance, which is used to assist in the accurate placement of the needle. Once removed, the cells are then analyzed to determine the types of cells in the nodule or node and whether or not they are cancer. In the case of lymph nodes, the physician may also wash the needle to test for thyroglobulin, which, if elevated, would indicate that the lymph node has thyroid cancer cells present. It is important to understand that this aspiration biopsy may not have a sufficient number of cells to make a diagnosis. If this occurs, a repeat biopsy may be necessary. In any biopsy, the pathologist can only interpret the tissue that has been obtained. Although the cells obtained in a fine needle aspiration usually represent all of the tissue in the nodule or lymph node, it is possible that there is other tissue within or outside the nodule that may be different. This is referred to as a false negative reading. Although the risk of a false negative reading is small, it is possible, and follow-up examinations are required. Usually, there is very little discomfort associated with this procedure. Your physician will discuss whether he or she will use any numbing medicine prior to inserting the needle for the biopsy. In general, an FNA is a routine and very safe diagnostic procedure. However, there are some potential risks. Bleeding may occur, which can cause discomfort, but it is usually very limited and will not pose any significant problem. If bleeding does occur, applying pressure and ice will help to limit the extent of bleeding. While many patients are concerned that an FNA may cause spread of malignant cells along the needle tract, the risk of that happening is extremely small. This complication is called seeding. While this may occur with other types of biopsies, in an FNA, the size of the needle is so small that the risk of seeding the soft tissues of the neck is extremely small. This diagnostic procedure is one of the most common diagnostic tests performed in medicine, and its safety has been well documented. Another possible complication is nerve injury. There are nerves that exist in close proximity to the lymph nodes and thyroid nodules that are biopsied in the neck. Fortunately, the risk of permanent injury to those nerves is extremely small. There is also a very small risk of developing an infection. To prevent this, the skin is disinfected prior to inserting the needle. Developing an infection is extremely unlikely. While an FNA is usually a very reliable and helpful diagnostic tool, it is possible for it to result in a false reading. This occurs when a biopsy is classified as malignant when it is benign, or calling it benign when it is actually malignant. The most common false reading is due to false negative results, which is why follow-up visits and ultrasound scans are important when a biopsy is negative for cancer. An FNA is generally a very safe and useful procedure. Significant complications and risks are extremely unlikely and will rarely pose a threat to the patient. You will be asked to sign a consent form after watching this video. Your physician will answer any questions you might have before undergoing this procedure.